It's sometimes helpful to walk through an example of our clinical model in action. Let's take a member, Sarah. She calls in because she just recently moved and she needs a new endocrinologist to help her with her type 2 diabetes. So she calls the number on the back of her medical insurance card and she gets Accolade. Her health assistant initiates a provider search. She then asks Sarah, "How's the move been going?" This isn't really what Sarah was expecting to be asked when reaching out to member services. Sarah really appreciates that human moment and ends up opening up and explaining that it's actually been quite difficult. It's hit the family finances hard, and it's taking a toll on her son, who has a learning disability and has been struggling at his new school and showing signs of depression. She shares that she's been missing work to care for him. In the course of their conversation, Sarah's health assistant gets her list of nearby in-network physicians with high scores on both quality and cost measures and offers to schedule an appointment. She also lets Sarah know about 2 things she believes could be helpful for her son. The first is that Accolade has a team of behavioral health specialists, licensed clinical social workers and nurses who can talk or message with her about her son's specific challenges, as well as those Sarah may be feeling in her role as a caregiver. Through Accolade's CRM system InView, her health assistant sees that Sarah has access to a mental health program that's offered through her employer. She lets Sarah know she'll send details once they end their call. She also lets Sarah know that Accolade has a team of medical nurses available to her at no charge who could help support her diabetes care. Sarah's very interested in speaking with a nurse for a more in-depth conversation about her diabetes care plan. Sarah's health assistant brings a nurse right into their conversation. Reviewing Sarah's record in InView, the nurse immediately notices that Sarah has not filled her diabetes medication. The nurse discusses this with Sarah and discovers this is due to the financial issues the family is having. Sarah's nurse suggests she use her mail order pharmacy benefit to make filling her medication more convenient and save money. She also identifies lower cost options, including a generic alternative, and suggests they discuss this together with her physician. So why does all this matter? Sarah's blood glucose levels have remained stable as she's in the care of a good doctor and compliant with her medication. Both she and her employer's healthcare spend is reduced thanks to the avoidance of complications given the stability of her glucose level and the selection of the generic medication. And Sarah's son is doing better at school and responding really well to the therapy options Sarah learned about through her employer's program. She's feeling healthier and energized by her son's progress. Her attendance and work performance have markedly improved. And importantly, she'll continue to engage with Accolade for large and small matters because she trusts us. She knows we're looking out for her and her son. And this all sounds really simple, but it's really hard to get this right. It's the combination of our mission-driven people and our purpose-built technology that lets us do what we do here at Accolade.